Anxiety and agitation in patients with dementia. This is a huge issue for patients that suffer from any form of dementia, Alzheimer's. The anxiety and agitation is present in nearly 100% of these patients at some point or another in the progression of their disease. And it is one of the most distressing symptoms for both the patient and their family or caregivers. It is totally associated with early institutionalization. And there's a lot of people that are, trying to keep their parents out of a nursing home and having a hard time with these specific symptoms. Try cannabis before you make a decision. A trial of this is a good idea. The antipsychotics that they often offer for these symptoms, all on the Beers list again, and they have a lot of other side effects that just make them, a rough choice for anyone that has to take them, and definitely something that you should use with a lot of consideration before choosing it for an older adult. So a little science right here. One of the things that cannabis does that is great for these patients is it stimulates autophagy, which is critical for healthy aging. What autophagy is within your cells, it's the process of when parts of the cell are old, abnormal, damaged, the cell eats and kills those parts, recycles it. So it keeps the cells, healthy and moving. And as we age, our ability to do that is kind of reduced, and in patients with cognitive decline, it's especially reduced. Cannabis can help stimulate that. Also, the whole way that cannabis works is enhancing communication between our cells. So that's really important. If we can get that in the brains of patients with Alzheimer's or dementia, that's what we need. And we have a lot of studies showing neuroprotectives and neural anti-inflammatory properties in the brain for cannabis. Again, for this population, edibles is what I think of. That full spectrum cannabis oil tincture that I was talking about can be easily mixed into food. And I also like the sublingual buccal approach, as in like a lozenge or a popsicle. Often I recommend patients mix oil into yogurt and freeze it with a popsicle stick and have the patient just eat the popsicle. That way they're kind of sucking on it. They're getting some absorption in their mouth as well, and getting a faster onset, especially if they're experiencing anxiety and agitation, and as well as the longer lasting effect of the edible. So that would be my general strategy for that. And if you or a loved one has a dementia diagnosis, consider this. There's a lot of information out there, and of course you can always reach out. I'm happy to consult with that. If anybody has any questions now or later, please reach out to me.